But when a shock happens, we also know that there is a certain pattern of people, how people cope with that. And one of the most important one is adaptation and changes in what people eat. First of all, they reduce the intake of the more expensive foods. And the most expensive foods are also the most nutritious food. They have the most vitamins and minerals. The ones that have the meat, the animal products, the eggs, and the green leafy vegetables and the fruits. And we know that that is how people cope from evidence from the 90s in Bangladesh, for example. When the rice price goes up, people actually still maintain their rice consumption because they need to, their bellies being filled and they need the calories. But they cut out the animal products and they cut out the vegetables. And that had a very strong and direct correlation with the underweight among children. Similarly, in the financial crisis in Indonesia in 97, 98, rice prices shot up. And there again, green leafy vegetables, animal products were cut out. Underweight children was not as much affected, but anemia among children was very much affected. And interestingly, the mothers suffered much in their weight. So there is some evidence that actually the mothers take the hit to make sure that the children still get enough food. Now, why is that important? There's about 1,000 days between conception and the second birthday that if you don't get the adequate nutrition and as a result you're stunted, you don't get the height as your potential height should be, you are basically condemned for life. Stunted at age 2 means stunted for life. And that has huge implications. There is a very strong evidence now published, for example, in the Lancet series in January 2008, that if you are stunted at 2, you have lower health throughout your lifetime, you have lower educational attainment, and your productivity is lower. And actually, there was a study done by IFPRI colleagues in Guatemala, where in the early 70s, there was one village who got a nutritious drink called atole, and another village did not, or get a less nutritious drink. And they followed these kids up 30 years after they got this drink. And they found out that the kids who had this drink 30 years before had wages 46% higher, controlling for all other factors, so including education, etc. So this is very critical. So a small shock, or even a few months, that affects young children will have an impact throughout their lifetime.